This exercise is a standing hip shift and in split stance position. The first thing you want is be able to have some sort of contact with your hands, be able to kind of help support you if need be. So you can do this with a rig, you can do this with holding onto two broomsticks, like bedposts, whatever it might be. You're going to first get into a split stance position, and usually your PT will tell you maybe if you want he or she wants 1 foot forward or the other. I'll show you here with both. So I'm going to start with the left foot forward, okay, and right foot back. Now in this position, in a split stance position, you're going to have your most of the way through that front foot with that back foot in a kind of a kick stance position. So it's just kind of there for balance. We're going to start with a little bit of knee bend, holding on to our whatever you're using. And then I'm going to have you turn the opposite hip of whatever foot is forward towards that knee, that forward knee. Now, as you're turning, your front knee is going to want to turn out to the side, right? And your back knee is going to want to turn in. And I need you to make sure that both of those stay kind of symmetrical over the legs. So as I turn, I'm going to turn that hip here, okay? Keeping that front knee in, and I'm keeping that back knee out, and then I come out of it. It's pretty simple and like very little motion, okay? However, you might feel your adductor kick in on your front leg side as you try to keep that knee in, which is kind of important. You might feel kind of like the glute, lower glute max kind of kick on that back leg as well, which also is totally appropriate and fine. Okay, I'm gonna kind of switch legs here just to show you on the other side real quick. Okay, I'm here, I'm turning, I'm keeping the knee in, and then back. One thing to be aware of with this exercise is it's very common when trying to turn that pelvis towards that lead leg to be able to rotate too much through your spine, and that would kind of look like this. Okay, so my spine is over rotating more than what my pelvis is rotating at, right? That shouldn't be the case. The spine should just slightly rotate, just following the kind of the pelvis as it turns. Okay. So it's just this motion here. And then back. Coming here. I might have you hold, or your PT might have you hold this for a certain amount of breaths to kind of do whatever they direct you to do.